Welcome to the December 2016 Dementia Dialogue. My name is Jan Doherty, and I will be the moderator for this month's program, Finding Myself Beyond My Role as a Care Partner. Just want to remind those who have participated in the past that you do have the opportunity to submit your questions today by typing these questions into the question pane of the control panel. You can send your questions in at any time, and we're going to collect these and we will address them during the question and answer session at the end of today's presentation. For those of you calling in on the phone, unfortunately we're not able to take this information or your questions, but certainly you can reach out to us for added information. Well, it's now my pleasure to introduce to you our speaker for today's session. Susie Favreau is a licensed clinical social worker at the Stead Family Memory Center here at the Banner Alzheimer's Institute in Phoenix. And she provides both individual and group therapies, working both with individuals who are affected by dementia as well as their care partners and caregivers. Susie is a gifted clinician and educator, and right now she's been leading efforts to better support the grief and loss experience of caregivers using the conceptual framework of ambiguous loss. Susie, we're going to let you take us through this session.
Thank you. Well, today we're going to talk about caregiving. And as I'm sure everyone on the line knows, caregiving is often a complicated and an intricate and sometimes perplexing role. And often I hear caregivers ask, you know, is there a me beyond what I'm doing here? And so that's what we want to discuss today in Finding Myself Beyond My Role as a Care Partner or a Caregiver. Today what we're going to accomplish are the next few things here. First, we're going to talk about ambiguous loss, what it is and why it's important. And we're going to talk about how ambiguous loss differs from other loss and grief. And then finally, to look at new approaches toward increasing our tolerance for ambiguity and change, which is all part of the caregiving experience. So when we talk about challenges of caregiving, we often hear the words stress and burden. And often those are actually entities that are often measured to determine the intensity of the caregiving experience. But as we kind of unravel that, we really find that actually the culprit might be the underlying grief that leads to that sense of stress and burden. Pauline Boss, a family therapist, developed a theory back in the 70s that named this unique experience that is part of caregiving. And the theory is called ambiguous loss. An ambiguous loss is one that is unclear, it has no resolution, and it has no closure. And she explains that it happens in two scenarios. The first scenario is when the physical body is missing, but the loved ones or the family, friends, are still holding on to that person, still missing that person, because there's no verification of what's happened to the body. I think the most recent example of that was the Malaysian airline that crashed a couple of years ago. And not too many, a few months ago, it was the 2-year anniversary of that. And the country had come out and said, you know, we can't look for them any longer. And the family members were horrified. They couldn't bear the thought of not having some answer, verification of where their loved one was. So that is one type of ambiguous loss. The other type has to do with when the body is physically present, but psychologically the person is changed or absent from how they once were. That's the type of ambiguous loss that occurs in dementia. Dementia creates ambiguous loss. And the loss is unclear, it's confusing, and it's unpredictable. And it's very fragile because, as we know in dementia, There may be moments, there may be days where the person is very much like they once were. But within hours or a couple of days, again, it becomes very unclear and unpredictable. And it's very hard to kind of wrap our mind around that. The status as absent or present remains unclear. And it's really unlike anything else that we've ever experienced. The basic premise of ambiguous loss is that when a person is lost only partially, the ambiguity, along with the loss, is a powerful barrier for coping and grieving. And it's what often, Boss refers to as frozen grief. But with ambiguous loss, there's no familiar ritual, there's continued deep sadness. And that confusion and lack of support can really lead to what looks like depression, anxiety, certainly family conflict, and caregiver isolation. It differs from other losses in a number of ways. First of all, it really complicates grief and loss. I want to just paint a picture to kind of illustrate this. I want you to think of two couples, maybe on the opposite ends of town. And the first couple, Betty her husband is out mowing the lawn, and he suddenly collapses from a stroke. The paramedics are called, and unfortunately on the way to the hospital, he dies. He's pronounced dead. Now, certainly a shock, a horrifying thing to happen. But Betty was certain that he was gone. The loss was clear, it was acknowledged, and it was official. She, of course, was shocked and numbed, but along the way, she had support from family, from friends. She had kind of that template that we all know about when someone passes away, of a funeral, rituals. We somewhat know what to expect, and we have the support of others around us. On the other side of town, another couple, the same thing occurred. And Jean's husband collapsed, but he got to the hospital and he survived. And that was kind of a miracle. That was a fabulous thing that happened. However, by the time he came home, and months from then, Jean recognized that something was seriously different. He became increasingly confused and was diagnosed with dementia. It was very confusing to her because she knew something had dramatically been lost, and she felt as if somebody had died, but then felt very guilty for even feeling that, because how could you grieve somebody that's still alive? But he was so different from how he had been, who he had been. She felt alone. Few people even recognized that she had a loss. Her loss was complicated by ambiguity and confusion of not knowing when the loss was going to be final. Her loss was painful, but it provided information. It was very clear that Betty's loss was painful, but it provided information, and there was less doubt, and she was able to move on. While Jean felt very much in limbo. There was no resolution in sight. Having to accept the loss and acknowledge the need to grieve for someone who still is alive is very counterintuitive. And what it can cause is what looks like depression, but in fact may really be ongoing sadness, and what looks like anxiety can be ongoing stress and confusion from not being able to fix the situation. Boss suggests that ambiguous loss creates complicated grief, a grief that goes on too long. But the complication is not the fault of the caregiver. The complication is the ambiguity caused by the dementia. So it's really an external context. It's not any weakness of the caregiver. And sometimes it's thought, sometimes the caregivers wonder what's wrong with them. Well, it's not that the caregiver is sick, that the situation is not right. The situation is sick. There are continued losses through the course of the disease. As the disease progresses, continued losses occur. So they may start very small. Maybe the person with dementia has trouble finding words, maybe forgets dates. But throughout the progression, more significant losses occur. Inability to drive, not being able to manage their own medication, down the line not recognizing family members. Each of those are continuous loss of recognition that something has dramatically changed. And not knowing if the loved one is here or not here is really a barrier to cope and grieve. And that's what keeps caregivers from sometimes doing the things that really need to happen, perhaps to address legal and financial issues, to do things like take away the car keys, even though the caregiver knows it's not safe. It's just another reminder that that person has lost the ability, so you tend not to do that. And again, Boss refers to this as frozen grief, the inability to get things done, and it can keep the caregiver feeling hopeless and stuck. Dr. Boss has written that what looks like depression is often sadness, what looks like anxiety is often the stress and confusion that sometimes comes by the inability to fix the situation. Ambiguous loss differs from other losses as well because it really confuses relationships. The relationship with the person with dementia is very much different. And even early on in the diagnosis, it can confuse and disrupt relationships among family members. Not everybody agrees with what's going on or even recognizes or maybe even agrees with the diagnosis. And there can be confusion, disagreement, which leads to often the caregiver feeling very much alone in their role. It's very important in this type of loss, an ambiguous loss, to grieve as you go. The losses continue, and they need to be marked. They need to be recognized in some way, and ideally to be recognized with other people. It's important to recognize the loss of the hopes and dreams you had together, recognize the loss of the person's previous roles, but important that that's done with people that you care about and that can support you along the way. So why is it important to even know or think about ambiguous loss? Well, it's an avenue for us to help change our perceptions. When we can't control the disease, the one thing we can control is how we see it. We can change our perceptions and find some hope to live with this. I want to give you a picture of when we were starting to work in this area. I met a caregiver who just personified ambiguous loss. She was a woman that had married late in life, and she, after 20 years of marriage, was still head over heels with her husband. He had been kind of her Prince Charming, who she had looked for all her life. And they had had a wonderful life together those 20 years. They shared interests, they shared humor, they were just kind of the ideal couple, and she felt very grateful for that relationship. He was diagnosed with dementia, and within a year or two, she was seeing dramatic changes that she really had trouble accepting. On his good days, he would have a little less word-finding problems, and he could have some flashes of who he used to be, kind of happy and engaged. But many days and continued days, he would have not such good days, and then he would become very frustrated. He'd become very angry. He had difficulty doing what he had once done easily, and often his anger was directed at her. She found herself really immobilized. She chose, well, I was going to say she chose not to do things. She couldn't move. She couldn't follow through on considering getting legal and financial issues in place. She couldn't make decisions about what she should do next. She was stuck, and she horribly felt very, very strongly that she saw no hope. She saw doom and gloom. Most everything was hopeless. she tried to follow others' advice by going to a support group and thinking, okay, maybe I can find some help here. But she found herself actually enraged as some of the caregivers there suggested that they had spent time away from their person that they loved, that they were caring for, and they were developing additional relationships or friendships. And she found this very distasteful and felt that it was very disrespectful. She could not find any meaning in her situation, in her current situation, and without any meaning, it's pretty hard to find any hope. This was her new reality, and she didn't know how she could live with this. She described herself as a fixer, that she had always been able to identify a problem and do something about it, and this was something that was beyond her ability to fix. So it's important for us to know what this is, to allow us to appreciate the person for who they are now, because when we can change our perceptions, it can help us appreciate those moments and those days that they are who they are, and that we cannot just spend all our time longing for what they or who they used to be, which is how she had been spending her time. It's important because it provides us some guidelines to help us develop our own plan, that while we're caring for our loved one, that we can care for ourselves simultaneously. Caregiving can make us stronger. And as we go through this process, and that's what's so fabulous about the job I get to do, is work with caregivers every day and see the resiliency that they develop, to recognize that they are able to do this, they're capable of doing this, and they can find some meaning in it so that it can provide them hope. With ambiguous loss, resiliency is found in learning to tolerate and feel comfortable with this ambiguity. And it can help us not only in managing our caregiving role, but in other aspects of our way as well. We become more stronger, more resilient, and become more comfortable living with the unknown, so it doesn't feel so odd, and it can actually feel a little bit more normal. So how do we start this? How do we begin? Well, the first thing I really recommend for everybody is to read Pauline Boss's book, Loving Someone Who Has Dementia. Dr. Boss developed this theory, I told you, back in the 70s. She had been working with children that had significant emotional problems. And she was seeing a theme in terms of the family situation, of one parent being somewhat absent. And around that same time, she also started working with families of downed Vietnam veterans or pilots, and recognized a similar pattern. And that's where she came up with this theory of ambiguous loss. Naming the problem is vital, because without that, a person knows that they're having these conflicting feelings, confusing feelings, and often uncomfortable feelings, primarily grief, but guilt and anger. And knowing that there's really something behind that, it has a name, in and of itself can be very helpful. When we started doing this work and just started informally talking to caregivers about this, as we talked about it, people would cry, because it was like, this is exactly what I'm feeling, and we didn't have a name for it. So now we do. So that's the first part to begin in. The second suggestion is to use what she calls paradoxical thinking. It's both and thinking instead of either or. In our culture, we tend to really value either or. It's either this or it's that. Nothing in between, this, black or white, not the gray. Well, that's not how dementia works. Much of what dementia is gray, and a paradoxical thinking is holding two opposing ideas in your mind simultaneously, and both of them are true. So an example would be, I'm caring for my dad, and I need to care for myself. Another might be, I miss and I long for our past hopes and dreams, and I look forward to my future plans. This strategy doesn't come easily. We don't often have this kind of thinking, so it takes practice. But once we can use this well, it can help decrease our stress about the ambiguous situation that we're in. It can be both and. And I just recently, at a workshop that we did, I think I heard the best both and statement I had ever heard. A caregiver said, this, referring to dementia, was the worst thing that's ever happened, and it's not the worst thing that's ever happened. And with that, there was a calmness about her, where she had accepted this, and it was able to live and express both of those equally. Next, we want to think about changing perceptions by looking at the idea of a less than perfect solution and finding the middle ground. Most of us don't like ambiguity, and we really try hard to fix it. And that can lead to premature closure or denying that anything's been lost. When we lack information, as we do in ambiguous loss, we think and feel based on our perceptions. But we have the power to change our perceptions. We can't change the disease. We're not going to change that. We can't fix that. But we can change how we think about it. And I want you to remember the wife I told you about who couldn't imagine living with anything less than a husband, anything less than her husband that she had lost to the disease. This is where it can be helpful to decide to accept a less than perfect solution, because things can still be good and less than perfect. And when you really get down to it, most relationships aren't perfect. So it may be not so different than what we have done naturally, but it's really making the decision to choose to think of it that we can still have a relationship, even if it's not the same relationship or a perfect relationship. Pauline Boss offers some guidelines. There are 7 guidelines that she outlines in her book, and I'm just briefly going to review those. This is not a to-do list. This isn't going from 1, 2, 3, and you have to do all of them in sequence. But instead, it's really a fluid and flexible idea that not all of these are going to have the same meaning for every person. And actually, as people progress through the dementia process, some of these will be meaningful at one stage and others at another stage. So they all kind of are interchangeable and can be used as they make sense to you. The first step is to find meaning. How can I make sense of this loss? It's sure difficult to find meaning with this when everything you thought you knew about your relationship has changed. And as the incongruity continues, it becomes increasingly confusing. So that paradoxical thinking can come in real handy. It can be helpful to still see it as a relationship, even though it's not the same relationship that it was. I want to share a story of a couple, too, that demonstrated this. The wife hadn't read this book. She hadn't gone to any classes. This had just come naturally to her in finding meaning for what had happened. So when I met this couple for the first time, her husband, who had dementia, had been a well-known businessman and had been very prolific in his career. He had been very directive, and he had been very focused on his career as well. And as I talked with her a little bit, it was clear that he had spent much of his time in his career pursuits and less time in the family life, which had been okay with her. It had been a good marriage, and she had been happy with that. But as his dementia progresses, his behavior and his personality changed a bit to where now, at the time I met him, he was quite pleasant and he wasn't very directive, but he was really living in the moment. And she found a lot of satisfaction in that because she was seeing parts of him that she hadn't been able to see previously. Unlike years before, now when she would come home from work, because she was still working, he would light up, he would tell her how much he appreciated her, and they enjoyed moments together, simple moments that they had never really taken time to do before. Along with this, too, I love this piece of it. This guy loved blondes, and his wife was blonde, and she had been very wise. She continued to work and enjoyed her job and decided to make this work for both of them. So she hired 2 young blonde caregivers who he was crazy about, and he was so happy and delighted to have these kind of bevy of blondes with him. So she had been able to really find meaning in who he was now. And she didn't have to grieve who he used to be. She, in fact, was very pleased that she got the best of both parts of him. I think that's a great story of finding meaning in this. Next is to balance control with acceptance. And this has to do with our need to temper mastery. We are a society of mastery. We see ourselves as problem solvers. We want to fix something, identify it, fix it, and move on. And as we all know, dementia doesn't fit in that scheme. We have a need for control. And when we can't control things, we feel kind of uncomfortable about that. And that can lead to, as I mentioned before, sometimes premature closure or not doing what we need to do. There was a couple that I met where this happened, where the person with dementia was very young, the younger couple in the late 50s, and the wife was diagnosed with young onset dementia at a time when they were just thinking about retirement. And this was devastating to her husband for the first few months. He could not imagine going, he talked about it as it's as if she's died twice. The diagnosis seemed to him to be almost a death, and then he knew that at some point she was going to die again. He couldn't go through that. That was premature closure. Now, he eventually was able to move through that, but that can happen when we feel like we can't control the situation, and that keeps us from accepting it. So the new goal is to become more comfortable living with the ambiguity of dementia and tempering our need for mastery. And that can be done through prayer, meditation, and controlling the things we can control. We can't control the disease, but we can control, for example, our bodies. We can maybe immerse ourselves into exercise, or maybe control our minds by learning more about the disease. We control what we can. We need to stop thinking that it's our fault. We need to externalize that and put the fault where it lies, on the illness. And along the way, work on lowering our need to control and manage everything, because we're not able to. That if we can learn to go with the flow a bit, if we can learn to accept some of this ambiguity, it doesn't have to terrify us. Next is to broaden our identity, to reconstruct the identity of who am I. Our identity gets very confused sometimes while we live with dementia, revising our identity to fit the new situation. A young woman in a caregiver support group, a daughter, came to the group one day and said, you know, I don't know, my mom doesn't know if I'm her daughter. Sometimes she thinks I'm her sister, I'm her mother. I get confused of who I am. And the idea of broadening our identity is to recognize that we need to redefine it, to revise it, to fit the situation, to fit the dementia. That we can be both. There are times that you're a daughter, but you are providing care. you are a caregiver as well, or more like a parent. But that can go back and forth. It doesn't have to be absolute. So it's broadening our identity. And it's also broadening our identity to relationships in our social circle and in our family circle. A lot of times, this is the time where if we're not getting the support that we need and the help that we need from our biological family, this is where we start redefining who's in our family, who's in and who's out. When we think of family, we think the people that are going to have our back, that are going to be helpful to us. And unfortunately, that doesn't always happen when dementia is in place. A lot of different perceptions, a lot of different ideas sometimes within a family of what should or shouldn't be done. So if you find yourself in this situation, this is the time to start developing and identifying a psychological family. These are people that understand, that are there to help, and there to support. And they can be as much a family as a blood family. So broadening your identity. Managing your mixed emotions. There are many emotions in caregiving, and certainly some of them are wonderful and loving. And there are other uncomfortable emotions, and ambivalence is a big one. Dr. Boss has noted that ambiguity feeds ambivalence, and ambivalence feeds the uncertainty about which action to follow, which decision to make, and which role to play, or which task to perform, that frozen grief. Ambivalent feelings are those feelings that are total opposites. Love and hate, wish this was over, then feeling badly about that. These feelings cause a lot of angst and a lot of guilt. I think guilt's one of the most difficult feelings that caregivers experience. And what's important to managing these emotions is, one, to be able to share them with others, to understand that they're normal and natural, to be able to talk about them, and as a result, then not to act out on them. Because if we don't recognize these ambivalent feelings, they can negatively affect our relationship with a person with dementia. They can lead to abusive action, which is certainly not what we need or want to have happen. And they can isolate us from people and the support that we need. In our culture, suffering is sometimes thought to be a failure. And what this does is kind of push us to learn to manage our own pain. A question that Dr. Boss often asks people is, when they have these thoughts, are they thinking these things, I wish it to be over? Are you thinking this because you are suffering or the person with dementia is suffering? And that can be a real important question to ask ourselves, because sometimes I'm thinking of the couple that I mentioned earlier, who the man now was so enjoying his life with all these blondes around him, he wasn't suffering. So it's an important question to ask ourselves. Are we wishing these things because we're suffering or the person with dementia is suffering? Hold on and let go is the next guideline to coping. And this is revising our attachment. Because as time goes on with dementia, the relationship becomes much more one-sided. It's no longer as reciprocal as it once was. And that leads sometimes for the caregiver to kind of question the attachment. Am I still the wife if I'm the caregiver? And the goal of this is not to, there is still attachment there. The goal is not to detach, but to be able to hold on to the person as they are and let go of who they used to be. With ambiguous loss, attachment may remain, but because the relationship has changed in difference, it's more one-sided, so it does make us question that. The connection as it was isn't possible, but closure is not possible either. So letting go of the relationship isn't the goal. Remember the couple, the woman who had married her knight in shining armor. That attachment at one time was very secure, and it brought her a lot of pleasure. But because she wasn't able to revive that attachment to him the way he was now, it became a very anxious attachment. So the goal is to revive the attachment as opposed to detaching, and learn to become more comfortable with the ambiguity, not denying the loss of the relationship as it was. So you do that by accepting a less than perfect relationship, knowing that it's still the relationship. It's not the same, but it's still important. The both and thinking can come in and be helpful in this. And the recognition that it's very important to engage not only in existing relationships, but new relationships with others. As we're losing some of that reciprocity and some of that relationship with our loved one with dementia, we need to add those components from other people into our lives. It can help to reframe how we think about the relationship, that it's not absent, but it's been modified. And this can allow us to really be present with who our person with dementia is now and not longing for who they used to be. The next one is to imagine new hopes and dreams. And I think this is a tough one many times for caregivers. It's becoming more comfortable with ambiguity and feeling some control even when things don't go our way. When we can imagine hopes and dreams for ourselves, it can allow us to let go of trying to fix it and trying to find the right and the perfect solution. It can help us begin to accept the paradox of finding meaning even in meaninglessness or hope even in hopelessness. And finding new dreams isn't selfish. It's something that keeps us engaged and keeps us going for the future so that we can be the caregiver that we want to be. And those new dreams, they can be done simultaneously. Sometimes it's thinking about maybe planning for the future, engaging in other portions of your life that bring you great joy, whether it be work or volunteering or a grandparent role. It can be imagining future plans as well in the same way. Deepening spirituality, family rituals and family celebrations, and adapting those to fit the reality of the dementia as well. And then finally, the last one is taking time to mind yourself. And this is that whole area of taking good care of yourself. You know, caring for someone else and yourself at the same time is really a balancing act. And it's really not selfish, it's really self-preservation to take care of yourself. So it's important to assess your own emotional state. If you find yourself feeling so hopeless and helpless or depressed that you no longer go out, you no longer really are functioning every day, it's important to seek professional help and also to find social engagement with others to support and to be with you. So let's take a review here of ambiguous loss, what it is, and some of the high points here. Ambiguous loss is a chronic ongoing loss resulting from the ambiguity, the uncertainty of absence and presence. It goes back and forth. There may be in dementia, there's pieces and times that the person is very much like themselves, and then it goes away again. So it's very uncertain. It's an irresolvable loss because there's no resolution, there's no cure, and its symptoms very similar to complicated grief. It goes on too long. It's a relational condition. It affects relationships. It affects our relationship with the person with dementia, our friends and our families, and sometimes separates us from friends and families just at the time when we need them the most. And it can cause caregivers, care partners to feel immobilized and lead to excessive personal and relational stress. The goal of working through this and considering these principles is really resilience, building resilience and not closure. We get stronger from adversity, and we become more mature. There's kind of a new depth of understanding that life doesn't always go the way we think it's going to go or the way that it's fair. Bad things happen to good people. And as Dr. Boss says, the ego doesn't always get to have its way. It's an ability to say goodbye to the person as they were, but hello to the person who they are now. And trying to really increase our comfort level, to become more comfortable and calm about ambiguity in general. So how do we get there? What are some ways of increasing our comfort with living with this ambiguity? Well, the first one is to decide to let go of our need for certainty and to embrace it. Being able to see ambiguity is a good thing and a thing that can help us be stronger. Can contribute to our resilience. It's important to acknowledge our sadness as it comes and goes, and we need to talk about it with others. We can increase our comfort to live with ambiguity by changing our perceptions, by making that choice to do this. It's not resignation, it's not giving up, but it's understanding that we can't fix the situation, so we can change the way we think about it. This is a diagnosis that can't be changed, but we can change how we're going to approach it and how we're going to think about it. It's really reframing our thinking. We can increase our comfort in living with ambiguity by finding meaning and finding hope. And I'm going to start from the bottom here, finding meaning in the relationship that's changed, making sense of it, giving it a name, connecting to others, not doing this alone, both and thinking, adapting our family roles and our rituals as needed, understanding that ambiguity really forces us or challenges us to not be so rigid. Things aren't going to stay the same, certainly not with dementia and not with life in general. So it's finding the meaning in the relationship as it stands now. And that can lead to finding hope in ambiguity, to see the good in it, to realize that we are capable of living with uncertainty, and that there are some questions that don't have answers. There are some problems that don't have solutions. It's not either or, it can be both and. When we've done everything we can, sometimes we just need to go with the flow. And the things that can help would be to embrace ambiguity, kind of gaining some control, even when the ambiguity continues, and to understand that we've done the best we can. Dr. Boss, this is a quote from her that I think really sums up ambiguous loss. A good enough relationship is when you love someone with dementia. The goal is not perfection. The new standard for your relationship is simply for it to be good enough. Life with dementia can be less than ideal, but still pretty good. And that perceptual shift is under your control. Wondering if there are any questions or comments.
Susie, thank you for a really informative presentation. And we did have a few questions that came in, and I'm going to kind of parallel them in terms of how you presented this information.
Okay.
So one of the participants kind of wants you to expand on this both and area, these statements that this person feels might be very difficult to achieve. Do you have any other suggestions you might give in regards to this idea of both and?
Okay, let me see. So, two opposing ideas, both that are true. So, both and. So, The one I mentioned, I know I need to give care to my loved one. And without both and, it would be, okay, all my life has to be giving care to my husband. That's what my job is now. But the reality is that's not going to be sustainable. So I am going to provide good care, and simultaneously I'm going to take care of myself. I'm going to allow myself some breaks. I'm going to allow myself some time away. It's both and at the same time. Is that helpful?
Yeah, I think so, and I think it probably feeds into some of the other comments maybe about that sometimes this both and also means less than a perfect solution than maybe one might have wanted.
Yeah.
So another participant writes in and says, how can I get others in my families to understand the loss that I'm experiencing while caring for my loved one and being a caregiver? So we know that this can be an incredibly complex issue, and often it is the primary caregiver maybe who is experiencing this the most. What might you share with this particular caregiver?
You know, I think that's a great question. And I think you now have a name for this, and perhaps before you didn't. And I know with the caregivers that I've been working with, that's something that they have been able to go back and talk to their families about. That, you know, just to explain, you know, it probably seems odd, but I've come to understand that I've been grieving the changes and losses that continue to occur with my husband. And I know that other people that haven't gone through this probably don't even see it as that. It may be your opportunity to explain to people, your family or friends, that this has been a loss and that you have felt alone, and this can be an opening to ask for help, ask for what would be helpful from the people that you care about.
And it seems to me maybe even by sharing this that it might help other family members maybe appreciate that maybe why they're pulling away could be their own grief that they're experiencing.
Absolutely. They may be experiencing the same thing and not be aware of it.
Mm-hmm.
You can give them the book.
Yeah, sounds like that would be a really practical strategy. Another care partner writes, you know, this new hopes and dreams feels kind of impossible. And at the same time, this individual says, you know, that they feel guilty about new hopes and dreams because it means that perhaps their loved one won't be there any longer. How do you deal with this, or what thoughts do you have in regards to that?
No, and that's a tough one, and that's I would say that's universal. And so these hopes and dreams, it's the idea of doing things simultaneously. It's almost like both hands. They don't have to be even huge. You know, one caregiver thinking about had always considered in her future going back to school. So while her husband was, let's say, sleeping, taking a nap, she got on some websites and started looking at programs. Not necessarily going to enroll, just starting to plan for it, thinking about things in the future. Whether this person had dementia or not, I mean, that would be something that one might be doing. So it can be both at the same time. And it can also be small things. It doesn't have to be huge kind of new hopes and dreams. But it could be something realizing that, you know, before my husband had this dementia at this stage, I enjoyed going to yoga once a week. That wouldn't be an unusual or unnecessary consideration. That once a week you could find somebody to stay with him so that you could participate in something, engage in something that was healthy and meaningful to you. It's part of that taking care of yourself that we always say to caregivers, and people roll their eyes back, I can't do that. But if even small things, once a week or once every couple of weeks, going out with a friend, for example.
Really terrific, speaking to both kind of here and the now as well as really the future when the caregiver is no more, and kind of finding balance in that is what I'm hearing.
Absolutely.
So another person writes in that this presentation really defines their caregiving experience, especially the getting stuck part. This person says, I am stuck. So what would you suggest on how to begin? And maybe it parallels the discussion we just had with small steps. So what would you tell this individual?
Well, I think first recognizing that you've noted that you've identified that what you're feeling is real. It has a name for it. So you're not making it up. You're not crazy. This is occurring. So once we know it, now what are the steps to take? And they can start anywhere, and they can be very small. So it can be to decide, okay, what are all things I need to do that I have left undone? Maybe even making a list of those and deciding I'm a big believer in what I call an action plan, identifying something you want to do to make a difference, to address whatever it is that has been bothering you. And maybe once a week you identify a step or two toward that direction.
So that working on getting unstuck maybe has small steps that start where the caregiver might begin to see the light, is what I'm hearing.
Yep.
And then finally, I guess this idea of the psychological family is often new for some of our listeners today. Could you expand on that a little bit? Because I think it's often difficult for us to think about going outside of our usual family and friends to find support. Maybe give some examples on how to make that happen.
Well, I think the first step is certainly looking for a local support group, caregiver support group, because these are going to be people that are going through the same thing that you're going through. I talk to caregivers about support groups being kind of like, remember that old TV show Cheers? Took place in a bar, everybody knows your name. Support groups can be like Cheers without the alcohol. It's important to be with people that get you, that get what you're going through. And generally in a support group, you're going to find that. So that can be a really first step towards connecting with people that are experiencing a similar thing. In the groups that we've done here, that really has been the creation for many of them of finding people for their, quote, psychological family, because they share strategies, they share time together, they share a common bond that is very meaningful and very helpful between the two of them. But it can also be, reaching out to friends, maybe previous friends, or reconnecting with people that perhaps you've lost connection with because you were too busy, because you were so engaged in your caregiving role, and it felt at that time that there was no room for these other connections. But those are vital. They're just so vital to keep you healthy and to keep you energized. So it can be done through a caregiver support group, old friends, and it can even be done if really it's impossible or you live in an area where a lot of these services may not be available. It can even happen in, online support groups. So it can happen in a lot of different ways.
Yeah. Well, Susie, I think you have given us some wonderful ideas to think about in trying to move beyond this role of caregiver that can become so consuming, while also allowing yourself to experience the real emotions as a caregiver. So we thank you for sharing your time and expertise with us today. I do want to remind our listeners and our callers that this session is being recorded and will be available on our website later today if you want to listen again or share with others. We would remind you that this is the season of sharing, and sharing your experience with family and friends and helping them maybe have more insight could be a great gift you give to yourself and others. Also, the PowerPoint is located also on the webinar portal, so we invite you to go ahead and download that and save it. And finally, an evaluation will be emailed to you here in just a bit. We thank you in advance for taking time to give us your feedback. We hope that you will consider joining our 2017 series as we explore a variety of common sentiments, emotions that people experience in caring for someone, as well as a lot of situations that are difficult and experienced by caregivers that really require successful solutions. That's what we'll be doing in 2017. So on January 18th, we will explore the topic of understanding the emotional changes in people living with dementia. We hope that you'll join us, and until then, thank you for being with us today, where we bring the dementia education to you.